am so excited to have started this new venture with all of the vets that I've met and have learned about over the last few years. And so it's new for us to have a different veterinarian on here for you every week at 4:00 California time. Dr. Dim, what time is it for you out there?
It's 7:00 here.
7:00. So yeah. We were just talking, it's difficult for us to make sure everybody can come on because there's Dr. Dim you're in Florida, right?
Right.
Yeah.
Yep. East Coast.
And we're way over here on the West Coast, but hopefully everybody will get a chance to come on and ask Dr. Dim. But before we get started, I would just like to introduce you to one of the most fabulous homeopathic holistic veterinarians that I know, Dr. Michael Dim.
Well, nice to be here, Carrie. Great to be here.
It's so awesome to have you be a part of, or me be a part of, just this movement to try to get people to understand that there's so much more available to them. But there's a lot of confusion. And we talked, for those of you who are listening, we talked a little bit before we came on about that confusion. So Dr. Dim, can you kind of give us your definition of what a holistic and a homeopathic veterinarian, because you are both, and there is a difference. Can you help us understand that a little bit?
Well, as we were talking before the show, holistic veterinarians and homeopathic veterinarians are still trained in conventional medicine. And, when we branch off into holistic medicine or homeopathy, it's usually because of a frustration with the limitations of conventional medicine. In other words, we find that we're not really helping our pets live longer, they're sicker longer. And so we find that we're never fixing them with our drugs and surgeries and all the modern tools and techniques. But with holistic medicine, instead of kind of a cookbook way of preventing disease and treating conditions, we look at, in holistic medicine, it's that everything, in my definition, is it's a veterinarian who looks at the whole environment of the animal, which encompasses everything we put on or in their bodies in any sort of way, as well as their physical environment, their stresses that they're exposed to. So in terms of their physical stresses that we look at, we would look at things like vaccines, over-vaccination, the role diet plays and poor diets, too many uses of pesticides, those kind of things when we look at things from a holistic perspective. Whereas conventional vets are going to be using, a lot of, traditional hormones and antibiotics and steroids. Holistic vets will be looking at each individual animal as an individual and coming up with a unique treatment plan based upon that pet's individual constitution. And if we go one step further, when we go to homeopathy, that's a system of medicine under the umbrella of holistic medicine. And that would be a system of medicine using energy medicines based upon the principles of like cures like. And that's about as general of a definition as I can come up with.
Yeah, we did a podcast. Hi, Thomas. Some people are coming in right now. We did a podcast with Dr. Richard Pitcairn, who I believe is the father of homeopathy, I think, for a lot of people, at least the modern day. So anybody who, even though Dr. Dim just gave you, hi, Judy, Dr. Dim just gave you a quick definition of homeopathy, like cures like. If you want to learn a lot more about it, you could listen to that podcast we did. But I love that you talk about how homeopathy is an umbrella under holistic medication or holistic veterinarian care. But I want to go back to the fact that you still graduated from a conventional veterinary school. And the reason I want to do that, and this is for anybody listening, is I think that there's this fear to go to a holistic veterinarian as if they went to some other crazy weird school and don't know how to run blood tests and don't know how to use conventional medication, or that they refuse to use it. So my question to you before anybody else starts asking some questions is, do you still use conventional veterinary medicine at all?
Sure. I mean, we certainly use it in cases where, let's say, there's so much pathology that the animal's own body has trouble healing itself and needs some assistance. And we look at certain cases and we look at the clients where if clients really want a quick fix or a quick relief of symptoms, sometimes conventional medicine has its role there as well. And certainly in trauma situations or injuries or, foreign bodies, you're certainly going to need a traditional surgeon in those cases to either remove the foreign body or to actually, set the leg and that kind of thing.
Yeah, yeah. It's scary though, because I think there's so many amazing holistic veterinarians that are out there, and yet people think, oh, I don't want to go to a holistic vet because they're crazy. And I'm like, wow, if you get the right holistic veterinarian, you have so many different modalities that you have a bigger toolbox. That's really
Right.
all it is, right? You just have
Sure.
a bigger toolbox. And
Right.
it's unfortunate because a lot of times people end up at the holistic veterinarian when everything has failed, like you mentioned, right? Everything has failed. And now I go to the holistic veterinarian. And what do you think is the problem with that?
Well, the problem with that is, like I said, a lot of times they're coming to us when the animal's life force or chi has been really beaten into the ground by, years and years of drug therapies or like I said, steroids, immunosuppressive medications, chemotherapeutics. And so every time we put our animals through those procedures, even though sometimes they're necessary within the context of a conventional practice, even though that sometimes is the case, we do weaken the chi or the life force of the animal. And so that makes it harder for the body to respond to try and heal itself in those, in some of those circumstances.
Yeah. Yeah. Well, not only that, but don't you think if you start with a holistic veterinarian, they're also thinking about the future of what they do to the young pup, right?
Right, exactly. That's the most important time when new
Right.
puppy or kitten, because that immune system is being developed at those younger ages, and that's usually the most common time period where they're getting slammed with, as I said, polyvalent vaccines and multiple wormings and pesticides and started on chemical preventatives, and it's just doing a damage. Not just people say, well, he handled it fine, but we're concerned more about the long-term damage to the developing immune system when these young animals are bombarded like that.
So if somebody were to come into you and they had a puppy and you knew the puppy had worms, let's say he has tapeworm and he has tapeworm, what would be the route for you?
Well, I mean, for those kind of things, we can use certainly. There's homeopathy to treat that. There's, certainly you can use wheat germ and other, like Dr. Pitcairn has a whole section in his book on how to treat tapeworms. I'll often refer clients to Richard's book, to
Yeah.
look up index, and he's got a lot of good, neat suggestions nutritionally to try and make the environment of the intestines kind of not welcoming for the tapeworms. And of course, you want to always treat the constitution of the patient to make their bodies healthier so that they're more resistant to those in the future.
Yeah. Yeah. But like conventional veterinarians see the tapeworm and then they give a drug to kill the tapeworm. And that often will destroy the gut for longer periods, is what you're saying when you talk about
Yes.
worming.
Yes,
Yeah.
absolutely. Uh-huh.
Yeah. I often see puppies that I already know have been set up for failure. Just by the time they're 8 weeks old, they've already been dewormed so many times. And a lot
Right.
of conventional vets don't even test for worms. They just instantly do it. They don't even
Right.
know if they have worms. And I know that can be kind of a bit of a problem, but
And
that's,
they do it over and over again, like every
yeah,
week or and that's even whether they need it or not. So yeah, it's way overdone and causes a leaky gut and disrupts, like you said, the gut flora. And that leads to problems, not only locally in the gut, but systemically elsewhere in the body.
do you think that I know there's been some studies and that like the golden retriever's lifespan has gotten lower, less time. What it went from, I think, 15 to 9 or something now that the golden retriever's lifespan. Why do you think that's happening? Do you think that it is um, a generation thing, or is it all just the poor diets and stuff, or are we just generationally having sicker puppies?
Well, there's a breeding component to that, Carrie, where you have clients that, breeders that are overbreeding these animals. That always plays a factor. And then it's generations of, doing the overdoing the conventional preventative model, such as, the vaccines play a big role in autoimmune diseases and cancers in this generation and, in future generations. And the pesticides, not only exposed to the environmental pesticides that all of us are exposed to, but the pesticides they're putting on them and in them, the flea and tick medications, the year-round heartworm medications. These are all stresses on the body. And then you throw in when the body tries to have a discharge or an inflammation or to push that stuff to the outside, like through an ear discharge or a stool discharge, then we're coming in with strong drugs to suppress that immune response or to suppress the discharge. And then that just leads to the body getting sicker at a deeper level, or what we call suppression in homeopathy. So, these are the reasons why we see breeds like the Golden Retriever and other breeds just more and more chronic illness, chronic disease. Yeah.
So young. I'm seeing dogs with diabetes so young. And
Yeah.
it's shocking to me how young I'm seeing these diseases in dogs.
Well, diabetes is just another example of, from poor diets that are filled with, processed carbohydrates and nutrient fillers. And also it's an autoimmune disease where the immune system destroys the cells of the pancreas that make the insulin. And then, that comes in. And of course, in Western medicine, they're giving them injectable synthetic insulins and processed commercial food from the big food companies, and thinking that that's going to be a recipe for health when it's just a temporary Band-Aid.
Yeah. It's interesting because I see, I don't know, maybe 50, 60 dogs a day. And people will come in and say, oh, my dog has X, Y, or Z. We can use diabetes, for example. They'll come in and they'll like, oh my gosh, my dog just got diagnosed with diabetes. I can't believe it. And I'll say, oh yeah, we have a lot of dogs with diabetes. They are shocked when they realize that their dog is not 1 in a million. He's like 50,000, right? And it's amazing how people who don't work in the industry really are shocked when they hear how many dogs I see with diabetes, or
Right.
they can't believe it. And then they're like, why? And I said, because, we're just treating symptoms and we're not paying attention to what diet can do. And all of these things have an effect. All of them. You've mentioned only a few of them, right? Flea and tick and heartworm and all this stuff. What do you say to people when you guys are being shy? I know you have questions. Dr. Dim loves to answer lots of questions, but it's okay because I have lots of questions all the time. What do you say to people when they say to you, well, you don't have any studies on that? Like if you want to use something and maybe there's 500 studies on why to use heartworm medication, but there might be one study on why not to. Do you ever have anything that you just
Well,
notice?
I mean, I tell them what the chemical is and what it does and how it's processed in the body. And
Yeah.
I also tell them a lot of medications, outside of heartworm, are not even studied in double-blind, placebo-controlled studies. And a lot of times what happens is we borrow medicines from human medicine and we just start using them in conventional veterinary medicine. And, that's something that, is not based on their model of science. And so, with a lot of these older therapies, like, for example, even homeopathy, it's not really conducive to the Western model, since each animal is given individual remedies based upon their symptom totality. And, and it's hard to study that in the Western medical model of science, the way what they're calling science. So, I try and answer them that way, that these are old systems, whether it's Chinese herbs or acupuncture. And, these systems go back often thousands of years, and, in homeopathy, hundreds of years. And so, it's the type of thing, Carrie, that, just because the drug companies carry on some studies doesn't mean that they're safe either. They're either not studying these drugs over a long period of time. That's an important, concept to have in mind. Or they're not non-biased studies, they're biased. So, I always, hold a grain of salt with when they use the word studies, because each of the drug companies trying to sell their products, right?
Yeah, it's crazy because I think people are shocked quite often when I tell them, you know, the study that you're referring to, if we go back and we actually look at it, you'll find out that that study was 12 weeks long. And
Right,
that's just not enough time to
right,
convince me that I can give an animal this drug every single month for the rest of his life, when,
right,
we might have given it once or twice. But we hear a lot, when we're trying to defend our way of thinking, that you guys don't have studies, you don't have, that's all anecdotal. But I just wish people wouldn't discredit someone who's been in the industry like yourself for so long. What we see with our own eyes, right? Like
right.
seeing an animal, knowing, like, we could look at the flea and tick medications. I have literally witnessed a dog have a seizure right after giving that medication. It doesn't take a study to tell me
Right.
that this is a problem, but you still have people that fight it, right?
Sure. No,
Oh,
absolutely.
no. It wasn't caused by that.
Right, right. Or if the animal just has a milder reaction, it just acts differently. Or if they
Yeah.
get a all-in-one heartworm medicine and they act lethargic or get a little loose stool, but they say, or when the animal used to take it chewable every month and then all of a sudden stops taking it, that usually indicates the animal's telling us something that maybe not be good for it.
Yeah. Every time I take that, I get sick. I
Right,
had a dog board with me one time. This was back. So at this point now, I won't even give it to your dog. So if your dog's going to board with me and he's supposed to take one of those pills, you have to give it to him before he comes. I can't
right,
even physically do it.
right,
But back before, I wasn't an advocate of it, but I would do it. Like if he had to have it on the first of the month and he happened to be boarding. So we had this dog staying with us one time and we gave it to him, and within 30 minutes, if that, the dog started drooling and throwing up.
wow.
Oh my God. So I called the mom and she goes, "Oh yeah, he does that. The vet said just wait 30 minutes, he'll be fine." And I'm like, "What?" If
Right,
I took a medication and then started drooling and vomiting, I don't think I would be like, "That's okay." And I don't think she really did, but when the veterinarian told her it was okay. But it's interesting that we don't pay attention to the body rejecting something.
right, exactly. And those are obvious examples, then you have
Yeah.
the more subtle examples, like I said at the outset, where we're not seeing it clinically on the outside, but under the surface, we're having all these organ stresses that eventually build up and it erupts into whether it's a cancer or an organ failure, or liver or kidney. Those are usually the end results of toxic damage over years and years.
Yeah. It's a hard thing to have people listen to us just say these are things we've seen happen.
Right.
Um, what do you think about the future of veterinary medicine? Because lately I've been thinking, like, a lot of vets are getting out of this and kind of quitting and leaving since COVID. How have you been going through this? I know it's been tough on all the vets.
Yeah, well, I mean, I have a big telemedicine practice, so I have a local house call practice where people come to my home in South Florida. But I've been doing telemedicine for much of my holistic career. So when COVID came along, it was just another, just actually more reason to do more telemedicine.
Yeah.
So it's tough. I mean, veterinary medicine does have a big stress level on all of us, whether you're a conventional vet or a holistic vet. And at least the profession in general, even on the traditional side, is really getting more aware of that and providing support for veterinarians to have more balanced lives, and to if they're feeling overrun or feeling worked out, that there's support for that. So
You went to a school, I believe it was in Pennsylvania, which is
right,
where?
University of Penn, yes.
Yeah, but wasn't there another, explain to me a little bit how you got into holistic medicine. I think it was that school, right? That helped?
Well, not really. I was out for about 5-6 years, and I found that actually, as I said at the outset, that animals weren't getting any better. That I had nothing more to offer them except the same merry-go-round of drugs and medications or surgical palliative procedures. And so by the time in 1996, 97, I saw an advertisement for a homeopathy course. This was about 5 years after I had graduated school. I saw an advertisement for a homeopathy course down in Alexandria, Virginia, by Christina Chambreau, who's certainly a dynamic individual. And I ended up taking it, and because of her dynamic style, I really was hooked. And then I took Dr. Pitcairn's course in 1997, 98, and started to add it to my repertoire. I was an employee at many veterinary practices over the years, and I started to have my own holistic practice, and kind of did both and do both for many years.
Were you scared not scared, but maybe a little apprehensive, your first dog or cat, I don't know if you can maybe share that story with us, the first time you decided to use homeopathy to treat an animal?
Yeah, I mean, I remember one of the early cases. I had just come back from a meeting. I was in the middle of the course, and the cat came in with a severe, very aggressive-looking skin infection all over its body, very ulcerogenic and bleeding with pus and all of that. And I had just come back from the meeting and learned about a remedy called graffitis, and I prescribed the remedy graffitis to this animal, and I never saw the animal again for a long time. And then the lady came back about 9-10 months later. We're supposed to follow up in 2-3 weeks, and the cat skin was all clear, but the cat presented for drinking and urinating more than normal, laying on cold surfaces, had lost a lot of weight. So she said to me, "You treated my cat's skin so well, now can you treat this problem?" And I immediately said to her, I said, well, I mean, I didn't say that to her. I thought to myself, well, I really did just have an example of suppression, because I gave a remedy that took care of a surface problem, but I didn't obviously treat the whole patient, because the patient got sicker on a deeper level. And so that's an example of where, you can get quick fix symptom relief even with a remedy, but if the patient gets sicker on a deeper level, then you haven't really cured your patient. But I was amazed at how the remedy resolved that really almost looking like flesh-eating bacteria. But like I said, didn't address the whole case. Then I had another case where it was a Basset Hound. That was one of the most remarkable cases I can remember, where the animal came into the conventional clinic, and the animal was paralyzed. It had an acute disc and it had been paralyzed for a few days, or it was getting worse over a few days. And the owner came in. It was a Western medical clinic, and basically said that, I said, I can give it a shot of steroids. We can send you to the surgeon and have an MRI and have a really expensive surgery. I said, but why don't we try just little pellets that I was just learning about, called homeopathy. So I gave the dog a dose of Nux vomica, high potency, in the exam room. And while my technician was going out to the front desk to get the paperwork ready, the dog literally within 30 seconds started wiggling its toes, and then jumped off the exam room table and ran out the door. It was the most amazing thing I'd ever seen, and it happened so rapidly. So that was an example of a tremendous response to a homeopathic remedy, and obviously was the right one in that acute situation.
Yeah, that is why I anecdotal, or whatever you want to say, like, we see these things with our own eyes, and then people just want to say, oh, well, you don't have a study for it. Well, I don't need a study. I watched it happen.
Right.
And I can only imagine the power of that. The power of, I remember when I first started using ozone baths on dogs, and the very first one I did, put her in an ozone bath, and I thought, I don't know, I hope I'm not just thinking this stuff's going to work. And I mean, her skin, just from one bath, I mean, it just went from dry, horrible, and it was amazing. And then you start almost like, I get hooked on it. Now all I want to do is ozone baths on these poor itchy dogs. I'm like, oh my God, it works better than any medicated shampoo I have ever used. So I get that feeling, and it's just this warm feeling of like, I did no harm to help, versus giving like an antibiotic that could actually, it might help, but it could also hurt. And so what a great feeling.
And then you get the, yeah. Oh, go ahead. Yeah.
We have a question coming through, but before we start, now that people start to get a little warmed up and they ask questions, but I do want to put out a disclosure before we start. Dr. Michael Dim is an amazing homeopathic holistic veterinarian, but he can't diagnose anybody's dogs right here, right now. But he can maybe help a little bit. And then also Lori's put up all of his information, and he does, what did you call it? Telepathic healing or what?
Telemedicine. Yeah, they do it over the phone.
Telepathic. I don't know why I said that. That obviously isn't. But we do have a question or a comment from Nina. She says Nina had an incident a few weeks ago. She looked like she was stretching, but she was locked stiff, front paw out, back leg out. I held her and rubbed her to calm her and relax her. I think it was a comment. I don't know if you want to put a little bit in there. I don't think that was really necessarily a question. But what do you think, just out of curiosity? Do you think she could have just...
It sounds like she might have had a mild either muscle spasm or even possibly a focal seizure. It sounds like it's been that, dogs will sometimes have transient seizures or involving one part of the body. It's called a petit mal seizure. It doesn't have to be a grand mal seizure. So in this case, it either was some sort of muscle spasm, the dog, just like we get, or it could have been, like I said, some sort of little focal seizure that just came and went. And I would probably watch, Nina closely in the coming weeks and make sure she doesn't have any more of those episodes. And if she does, then she probably needs a veterinary evaluation.
Yeah, find out. Seizures can be caused by, like, if off the top of the head, would you say 10 different things? Like, there's so many things. I'm thinking right. Like, there's so many reasons that seizures can happen, right? There's not any one cause. And so, yeah, having Nina looked at after, if she has those kind of situations, I would say would be where I would go.
Right.
What Thomas asks if you have any recommendations for a sore shoulder, like is there stuff that people use for sore soldier?
Well, again, sometimes that depends upon the cause of the diagnosis. In homeopathy, we would look at that as one symptom of the whole patient, and then we would ask questions about the rest of the symptom totality of that animal and coming up with a remedy, the history, the individual syncrasies of the animal. In other cases, if there's a sore shoulder, obviously there are, if it's coming from the cervical spine, then certainly chiropractic or laser therapy, cold laser, can be very, very helpful. Certainly acupuncture is well renowned for musculoskeletal and neurologic issues. Those are a few of the things that just come off the top of my head. Depending upon what, again, if it continues, then certainly a full evaluation and diagnosis would be indicated.
Yeah, Thomas, I don't know if this is for Ninja, if you're asking for Ninja, but if he is, Ninja has been through a lot lately with a lot of surgeries and vet stuff. So there could be all sorts of stuff going on there. Anyway, so I just want to point that out. That is part of why, like, a homeopathic veterinarian would need to know. So it is for Ninja. So there would have to be so much that Dr. Dim, which I would highly recommend you reaching out to him for Ninja to start looking towards some homeopathic treatments. I think Dr. Dim would guide you amazing and would do a lot of good because he's been through so much. His dog has been through a lot, Dr. Dim. Like, he's had a lot of surgeries and a lot of stuff. I think homeopathy would probably do him some well to help get some balance.
Absolutely.
Yeah. So I would recommend definitely for you to reach out to him. She said it was a question. She said her vet could not give an answer. Her vet has no idea why that is. I think Dr. Dim gave you a really good idea of what could be, and to keep watching. We're going back to Nina.
Mm-hmm.
I think that was great recommendation from Dr. Dim, is to see if it happens again. And then I think you were suggesting running some tests if it happens again, right?
Sure, absolutely. Getting a proper diagnosis and evaluation. That's the other thing, Carrie, you should bring up, that I often get calls. I mean, you mentioned at the outset that, holistic veterinarians still have to get training in conventional medicine. Those of us who are holistic vets still have licenses. So licenses to practice. And so the practice acts of each state are governed a certain way that we have to proceed. And so, if a client calls me and says, I don't want to do that stuff anyway, certainly if you get an older animal that's drinking and peeing a lot more and losing some weight, I mean, any holistic vet's going to recommend a blood panel to check the liver, kidneys, check for diabetes, other pathologies. And so, certainly a Western diagnostic workup is certainly appropriate in most in cases like that. And
Yeah.
so we can't lose wind of that when animals, even raised holistically, come up with illnesses or symptoms.
Yeah. Do you like I said, there's so many causes of even if it is a seizure, and I don't think Dr. Dim is suggesting that it's absolutely a seizure, but or I think, did you mention a stroke?
I mentioned muscle spasm.
Muscle spasms. Yeah. So, but what kind of tests? So I feel like a lot of people find themselves at a veterinarian hospital, and this has happened to me when I've taken dogs to emergency rooms. They come back with all of the tests that they can do, everything, the MRI, the blood test, the x-ray, and they kind of hand it to you and go, this is what we need to do.
Right.
Is there a reason why someone can't start with, can we just start with maybe a blood test or the MRI or the x-ray and then kind of move from there?
Absolutely. Yeah.
You can do that, right? Like, a lot of people feel like, oh my God, I went in and they had to run all these tests. And then you kind of look at it and you're like, well, we could have done the blood test first, because that might have.
Right. Well, it's like the art of practice, Carrie, is knowing which test to run. You could always, when you have your list of rule outs as a veterinarian, you could always run every test in the world. But, working with clients today in an economically challenged time, we want to always try and, be mindful of that and at least try and, from our clinical experience, what the most revealing tests will be that we're going to recommend.
Yeah. But how dangerous is it? I see, exactly like you said, we're living in economic times. Our gas prices are, I don't know about Florida, but Jesus, I'm riding my bike to work, by the way. But sometimes people think, oh, well, it's okay, just give him an antibiotic, don't run the test. What are the dangers of that?
Well, I mean, a lot of times we're suppressing symptoms with antibiotics, even in non-infectious conditions, like, for example, cystitis in the cat. That's a big example of mostly a non-bacterial issue that conventional vets will often use antibiotics. And the symptoms get better because the antibiotics have a suppressive effect on the life force of the animal. And then, of course, there's the issue of just using antibiotics and, willy-nilly, and you select out for resistant bacteria. And if it's not a bacterial infection, if it's a viral infection or an upper respiratory in a cat, a lot of times the antibiotics might band-aid it, but they're actually, a misuse of antibiotics that lead to resistant microbes over time.
Yeah, the reason I'm bringing that up is because I'm a big believer in diagnostics. I don't think any vet should be working without diagnostics.
Right.
But I also think sometimes we're thrown this idea that you have to run all of the tests right here and right now.
Right.
Let's just use, for example, if we thought an animal was having a seizure, we thought that was a possibility, is presenting symptoms that are seizure-like, and the veterinarian were to say, let's test these 5 things. Is there one you would choose first?
Well, I always tell clients that, seizures, most of the time, the baseline workup, the CBC, chemistry, and urinalysis, which is really indicated in any sick presenting animal, it's kind of like a baseline of metabolic function, we call it. And so even though it's a low yield procedure in a seizure case, you still need to check for low sugar and electrolyte abnormalities and infectious agents and that kind of thing. And you also need to know what the organs are doing before you manage those medically, whether it's with Western medicine or with herbal or holistic therapies. And so I always start with like a baseline CBC chem and urinalysis on most of the chronic ill, or acutely presenting ill patients like that. But I am telling the client when they come in that, there's a good chance we're not going to find the cause in the initial screen. It doesn't mean the client has to go to a neurologist and spend thousands of dollars on an MRI and a CT scan and that kind of thing. But it is, you need a baseline in the animal. And then whether the client chooses Western medicine to manage the seizures or a more holistic approach, at least we have an idea of what's going on metabolically in that patient.
Right, right. So blood tests start with.
Yes, yes.
And then work from there, but be prepared. I know I had a dog. Most people know this. I had a dog who I now know, and well, I should say I now believe died from flea and tick medication. This was back when I was a vet tech, and we're going back 27 years. But there was questions that she had a liver shunt that was causing her seizures. And so we had to do the blood work, and then we had to do the ultrasound, and there was so many tests that we did, and ultimately nothing was ever found. And which is why I go back to it being from the flea and tick medication, because nothing was ever found.
Right.
And of course I was a vet tech and I knew everything. So I just kept putting the flea and tick stuff on it.
Right.
It just breaks my heart that I didn't know. But when stuff first came out, nobody knew. I mean, there was no indication that this stuff would cause flea and tick medication because of, and we can go back to the studies that were done that told us it was safe and it was okay and we could put it on our dogs every month. But yeah.
I'll never forget when Advantage came out back in the 90s, and they told us when they presented it in the conventional clinic, they told us that, well, they use this stuff on our crops every day, so it's safe for us to ingest, so it's got to be safe for our animals, in other words, a pesticide. So.
Yeah, that kind of stuff just, I don't know, I look back on it and it breaks my heart that we weren't paying attention. And
exactly, Carrie.
It's actually one of the reasons why people, I have this list of veterinarians that are going to be coming on once a week with me, on the Wednesday nights. And for people who don't know, one of the reasons that I pick these veterinarians, it has a lot to do with flea and tick medication. And it's not that I don't think there might be a case, maybe possibly, of a huge infestation that maybe we had to do something. I don't know. But any veterinarian, I think at this point in time, with as much evidence as we have, including the FDA, who has now come out and said, yeah, this stuff is causing neurological problems. At this point, any veterinarian that is still willy-nilly every dog should be on it, I wouldn't recommend them as a veterinarian, because they're either not doing their research or they're just closing a blind eye to it because they're making a lot of money off of it.
Right.
So I can't. So when people ask me, like, which vets do you put on? Why do you do that? Is one of the things that is important to me. Like, how do you feel about flea and tick medication? And I already know your answer to it, or you wouldn't be on the show. But it is a guiding force for me. And I tell people, when you pick a veterinarian, you should be knowing these things. And what research are they doing? So Nina says that the vet did do blood work and urine, but they didn't think it was a seizure, and the vet gave her an antibiotic called, I don't know the name of this, enrofloxacin?
Enrofloxacin, yeah. Baytril is what it's.
It's Baytril.
Yeah, Baytril.
Okay.
Yeah. That's kind of a bizarre choice. I don't know where, that came from. What the choice of the antibiotic was for. Baytril is usually used for urinary tract issues, sometimes deep-seated respiratory infections. But, I have no idea where that one came from. I would think like some sort of muscle relaxant maybe, but I don't know.
But an antibiotic, And this goes back to what we were talking about is sometimes conventional veterinarians don't have an answer, and they use what they believe an antibiotic to be non-intrusive and it's harmless, and we'll try this antibiotic and we'll throw an antibiotic at it and see if there's some kind of infection in there. And doctors like Dr. Dim, right, you would be more like, well, is there an infection for me to give it?
Sure,
for me to give it? Like, because you recognize that an antibiotic could actually along the line cause more harm by killing off those gut bacteria. So it's interesting to me when veterinarians prescribe something without knowing why they're prescribing it.
Yeah.
Or right. I know I had talked to Dr. Morgan about this. We had talked about the problem with antibiotic resistant bacteria and what role we play in that when we're giving antibiotics to animals without knowing what kind of bacteria there would be.
Right.
Right. Matching them. So Deborah says that her dog, Deborah, this is heartbreaking. I have never heard of this, but I wonder, Dr. Dim may have. She says her dog died from an anaphylactic shock from the dye while getting a CT scan. She had severe allergies. She wants to know if this is common.
Not that I'm aware of, and not that I do CT scans in my practice, but from when we've referred cases, it's I guess from the anesthesia, they sometimes could, have a reaction to that, but I haven't heard of too many cases from the dye, no.
That's interesting. I mean, the vets that I worked for, it was so long ago, we didn't do CT scans at all, so that wasn't anything I was ever exposed to.
Right.
But I've never heard of it either, though my grandmother was allergic to the dye that they use on human, which I would imagine is the same thing.
Right. Yeah, I think so.
Right. I would think so too. So that's interesting. It would make me wonder if your pet has it's iodine they use, right, Dr. Dim?
I believe so. I'm not an expert on doing CT scans.
Yeah, I'm not an expert on anything, but
Sure you are.
I just wonder if they're using iodine, it would be kind of a scary thing to think if her dog had a reaction to the iodine. I would be really careful with certain foods, right, that have iodine in it.
Absolutely. Yeah. Too much iodine. Yeah.
Yeah, like this kind of stuff always interests me because then I start thinking, ooh, do we have a thyroid problem? Do we I start going down this rabbit hole of like, I would be doing some investigations to make sure that, there's not something else going on there. I am so sorry, Deborah. That is absolutely, it's horrible. I have a question for Deborah, though, if you get a chance to answer. What was your pet going in for a CT scan for? So while she's answering that question, because I'm curious what her dog got a CT scan for. I thought we were gonna answer that. So what else have you seen? Or I guess my better question is, what has been changing with animals that has been kind of interest of you lately? Like a lot of people are very shocked when I say, oh my God, Cushing's disease never even existed back in vet tech. And now it's like half the dogs that walk through my door. What about you? What do you see? What are you seeing a lot of?
Well, I mean, the number one thing we see in traditional vet medicine is chronic skin allergies, probably, and recurrent ear infections, and animals, chewing their feet and getting, secondary overgrowth of staph bacteria on the skin, and yeast and smelly skin. And, certainly they have the new wonder drugs now, the Apoquels and the Cytopoint shots, but there's a chronic healthcare price to be paid with those. I mean, Apoquel can exacerbate the tendency to cancers, and Cytopoint also is a monoclonal antibody technology, which has its own long-term chronic potential issues. But I would say skin is the number one thing that a traditional vet would see in their clinics. That's other than when they're doing their yearly vaccines and shots and that kind of thing.
Yeah, so many people are shocked when I tell them, oh yeah, there's not probably a dog in my facility right now that doesn't have a skin problem. Not one, probably. Like they're, even if it's just a little tiny chewing at their paw, it starts there.
Yes,
it does. First little oh, why is my dog chewing his paw?
Right, Gary.
And then it becomes, and it just gets out of control very quickly. And before you know it, the ears are blooding. Deborah says it was a medically unnecessary test. Wow. I wonder what that's about. You got to fill me in. I'm so interested in this. I brought her from I brought her for I can't read that word. It's cut off. Oh, a dental.
Yeah.
And she wanted to do a CT scan to see if anything was going on with her neck and head.
Sounds like a test that was not mandatory for a dental procedure. Maybe dental X-ray.
I have never heard of CT scan for dental X-rays. Absolutely.
Yes. Yeah.
But a CT scan, that's interesting. Maybe she didn't have, I don't know the vet, so I'm certainly not calling anybody out, but that always does make me wonder, did she not have an X-ray machine?
Yeah.
But that would be weird to have an X-ray machine and have a CT scan machine and not an X-ray machine.
Right. I
don't know the situation, but Deborah, I am so sorry. I can't imagine the the pain that must have brought on, knowing that it wasn't something that had to be done,
Right.
and led to something like this. That's just, yeah. Okay, so skin and ears, and that is just, it's an epidemic.
Yeah, I mean, and then we have dogs that are coming in for vomiting and diarrhea and, pancreatitis type symptoms. And, more and more animals are being diagnosed with that. And that's also often a dietary toxic issue. It all comes back to the same cast of characters and players that, we talk about with any of these chronic conditions. But a lot of little breeds with pancreatitis, the Yorkie, the Maltese, those kind of dogs.
They all have pancreatitis now. All of them.
And then in the traditional clinics, they're taking the animals and transferring them over to processed commercial food, which again, Band-Aid's a problem. And then because of the quality of the ingredients leads to other issues, other healthcare issues. I often bring up with that condition, like when they put animals on special urinary tract diets for crystals. And if you follow the health of those animals over the years, even though they might not have any more stones, maybe, then those are the animals we see that develop kidney failure. So the disease just goes higher up in the urinary tract. Again, a classic example of suppression from a homeopathic perspective.
This was years ago. I had a client a long time ago who had, this was before I knew as much as I know now, but her constantly getting stones, constantly. So they put her on, the prescription, whatever, and she still got stones.
Right.
but her mom, I would tell her mom, have you considered doing an unprocessed diet and change? Oh, I can't. She has to stay on this.
Right. That's the rhetoric that they've been told, right?
Yeah, like I have to stay on this because she's going to get stones. And I'm like, didn't she just have surgery for those stones?
Right. Absolutely.
So, but it is hard because you really do believe that this is a prescription diet and you have to stay on it. And
and years ago, they used to say that the animals were the main stone we saw were the struvites, the ammonium phosphate stones, and they would change the diet. And now they're seeing an epidemic of what are called oxalate stones, calcium, which are even harder to get rid of. So again, when you Band-Aid one problem, that usually leads to something else when you don't address the underlying cause.
Yeah. Why do you think, like, we could use pancreatitis as an example? Why do you think there's such a absolute difference in cause? So you could literally ask 20 veterinarians what causes pancreatitis, and they'll say high fat. And then you could ask another 20 veterinarians, and they'll say it's high carbohydrate.
Right.
I don't know if you've experienced that, but I mean, the difference is night and day. Same with kidney, right? High protein causes kidney failure. And then the other 20 vets say, no, it's not high protein.
There's usually mixed data on these things, and then vets choose whatever they like to pick out of that. So, for example, the high fat component of pancreatitis, a lot of the times vets will say table scraps, and then people say, well, my animal can't have any human grade food. And that's not the case. It's like, but if the animal gets pizza and greasy, high fatty foods, of course, like that, it's processed high fatty foods, not good for us, much less good for the animal. So those diets certainly can trigger a pancreatitis episode. But just the idea of high protein, high fat labeling some generic label like that is usually not accurate, Carrie.
So do you think there's a difference between, like you said, pizza, obviously like a high fat pizza diet versus, I'm sorry, I'm just having visions of my father giving his dog potato chips. And then she went and threw up, and he's like, I don't know why she threw up. Like,
right.
But is there a difference, do you think, between a high fat processed diet versus what our wolves would eat in the wild is a high fat diet? But is there a one size fits all, like all fat is bad, or is there a difference between processed fat and good fats?
Well, yeah, good fats are of course going to be healthier if they're, animals are eating the whole prey of the animal in the wild. That certainly has fat, muscle, and, muscle tissue, fat, bones, organs. That's all very good. That's what they should be eating. And then when you look at processed foods like pizza and meat with all the trimmings. The trimmings usually are what does it in, or the spices and the seasoning. So certainly it's those parts of those high fat processed foods that are the ones that are causing the problems.
Yeah. It's hard to get people to understand the what processed food is, because they just don't recognize that. And the table scrap argument, I feel so sorry for people when they come to me and say, I never give her table scraps. I'm like, oh, that's too bad if the table scraps are
Right, healthier table scraps,
chicken
sure.
and healthier. Yeah, I think there shouldn't be a difference between human food and pet food. If they're both healthy, they're just food. It's just food, right?
Right, exactly.
And kind
Just
of
food.
understand.
I always tell clients, just go into a vet's office and take a bag or a can out of the. Usually, they'll have a merchandising place in the lobby, and just take a look at a bag or a can of whatever commercial food they have sitting in the lobby there, and try and understand the ingredients. If you can't understand the ingredients, you don't have to be a food science major to really understand that it's probably not healthy. Yeah.
Did they teach you much about nutrition in veterinary school?
Not really. We, I think, got 2 hours our third year of medical school, and that was about it. We really didn't learn. We kind of graduated with a rhetoric: just feed a good commercial diet, feed one of the three main brands, Royal Canine, Hills, or Purina, and your animal will be healthy. And it's just, we didn't really learn about the basics of nutrition, and any nutrition we did get was sponsored by those pet food companies, whether it's in school or whether it's at a continuing education meeting.
That brings up such a good point, because so many times, people think their vet doesn't, well, when they find out that the veterinarian's selling something like Hills or Royal Canin and they realize what's in that bag, then they're mad at the veterinarian.
Right.
And I always say, listen, your vet only knows what they're being taught in vet school. It's not that they went to vet school to take advantage of you or to
Right.
feed your pet horrible food. But what you're talking about is all over in every vet school. Every single veterinarian I have ever spoken with about what they were taught in vet school, they were taught about these commercial diets, and that's all they were taught.
Right.
So when they come out of vet school, right, they think, I have the studies and I went to vet school and this is what they taught me. And I think we can all kind of understand. I don't think there's any vets out there that are trying to injure your pets. I hate
No,
when
I agree.
I hate when I hear all they're trying to do is make money. I'm like, I don't, that's
Yeah.
not that. I
Not
mean,
why
yes,
they go to medical school.
yeah,
Most vets are trying to do the best that they can, and with the knowledge base and their conception of understanding that they have. They're not in it to hurt animals or to gouge people. I don't believe so.
yeah, yeah. Hi, Annie. How are you? So, Annie is asking, what is a good diet for Nina? She's on Hill's Science Diet CD canned food.
Well, the short answer is probably a species-appropriate homemade diet. If you had Dr. Pitcairn back on, he'd say a vegetarian diet.
Yeah,
Where that's a whole other discussion in itself we don't have time for.
yeah,
But I would say, certainly, a majority of holistic vets would at least say a fresh, home-prepared or minimally processed, evolutionary appropriate diet, unless you were on the vegetarian bandwagon. But as I said, processed canned food as being a recipe for helping the urinary tract or preventing crystals usually isn't an answer in the long run. Yeah.
CD is for, God, it's been so long. CD is usually given for the bladder, right?
Right, for the urinary crystals, typically the Struvites, but now they have the CD. I believe it's like a multi-formula that does all the stones and all the crystals. So
Oh,
it's
geez.
to hopefully prevent, in some cases, treat existing crystal or stone problems. Yeah.
Yeah. So Annie, I'm not sure if Nina's on it for that reason, if she's had crystals before, if that's why your veterinarian put her on that. But as Dr. Dim is saying, and I could give you a long list of veterinarians that would agree with him, she's had that problem. She says, yeah, that she's had some crystals. Like I said before, I had shared a story earlier about a dog who was on exactly for crystals and still continued to get them. But then now
Right.
other problems started to form, right? Ear infections, weight gain, chewing at the feet, all of these things. And with a healthy diet, as Dr. Dim is saying, you could probably maintain those crystals and not have the other problems.
Right. And a lot of these urinary diets like CD and SD and all these diets have a lot of salt in them. So it makes the animal drink more water. And that's why they're having their effect. So you might as well just add a teaspoon of sodium chloride or salt to the food, and you're doing the same thing rather than spending all this money on these processed foods.
Wow, that's interesting. I hadn't even considered that. I know that they do it, but then when I hear
Right.
it, I'm like, oh my
Very,
gosh.
a lot of animals on these foods drink a lot of water, yeah, because there's a lot, and that's the goal, is to get them to flush out the crystals from their urinary tract.
And so we just make them more thirsty so that they can, oh my
Right.
gosh, I hadn't heard that one, and I've heard some stuff. There
Right.
was a client of mine that came a long time ago, and she had this cat, and it was a kitten, and it was a Bengal. And
Mm-hmm.
he's a kitten, and she comes to me, and I was like, oh my gosh, start him out on the right diet. Of course I'm going down that road. And she actually was all on board to put him on a species appropriate diet. And then I guess he got too wild. And
Mm-hmm.
so she went to the veterinarian, and the veterinarian says, oh, you can feed him this special diet. It's a diet to calm your cat. So
Right. Right.
I thought to myself, I didn't say anything to her, but I thought, I wonder what it would be that would calm. And I immediately thought something with tryptophan in it.
Right.
So I
Right.
go and I get the food because I'm dying to know. And of course it does. It has tryptophan in it, but it's all the way down at it's like the last ingredient. But you
Right.
know what it did have in it? A ton of carbohydrate, which
Wow.
makes all of us fat and lazy.
Right. Right. Exactly.
I was like, because she said it works. It's working. It wasn't
Right.
even the tryptophan that made it work. It was the
Right. Right.
abundance of it. So she says, well, I need to talk to somebody. I'm changing her diet. Love,
Yeah.
Annie. She didn't say love. I just threw that in there because I know Annie. So Annie, you can contact Dr. Dim. You can contact me if you want. I know you're local in California, but Dr. Dim is so amazing. And I'm sure you can help guide her to changing a diet for her issues with crystals. Do you think, Dr. Dim, if she
Sure.
contacted
Yeah, yeah, but
you?
again, nowadays, certainly there are many resources for home prepared diets. Like I said, the original Dr. Pitcairn book was all
Yeah.
about home raw meat recipes. Still has a few of them in his new book, but
Yeah, he has a new book. Yeah.
yeah. But in any event, sure, there's a lot of good resources. You out in California, absolutely.
Yeah. There's all sorts. It depends. Like I always tell people, it really depends on where you are with you, right? Like, do you want to cook? Do you want a commercial
Right.
diet? Do you want half and half? There's so many options out there. But the
So
one
many.
thing I think we would all agree on is that we can come up with all these different things, but the one thing I won't compromise is whether that's a whole fresh diet. Like I've had Dr. Pitcairn on here, and we talked about a vegetarian diet, and I learned so much from him. I'm never anti anything until I really start to learn a little bit. And I learned a lot about Dr. Pitcairn, and he's been fabulous. And he does definitely believe in a vegetarian diet, and he's been successful with it. I can't say that I'm going to switch my dogs to a vegetarian diet, but I have added more veggies to their diet from talking to him. But I'm learning a lot. So, but Annie, I would say reach out to Dr. Dim. He can help you make you feel a little bit, especially when animals come to me and want me to change their diet and they've had medical problems. I always reach out to you guys because I don't want to make anyone nervous. And then, my groomer said I should feed this, and then they go to the vet, and then the vet, now they're in between. So I always send those guys to you. Like,
Right. And I'm not a nutritionist. I usually guide these guys to the resources too, like Dr. Pitcairn's material or other, and try and work with the patient on other aspects of their health. There's so many foods out there now that are, like you said, back when he wrote his first edition of his book, there was, you had to get a mortar and pestle and do it yourself.
Yeah.
And nowadays, there's just so many companies. There's so many various raw meat pet food companies that are out there. Some good, some not so good. So there's a lot of variety out there.
Yeah. Are you a fan at all of small batch?
I don't have enough experience with it. I've heard of it. I've heard good things, but
I'm just wondering. I was going to suggest that to you, Annie. There's a
sounds good. Yeah, I've heard
small
of it.
batch, and they make a cooked version. So her dog's not a young pup. So sometimes the older dogs do a little bit better on the cooked version.
Yeah, sure. That's a good start.
Yeah,
Right.
yeah. It's got a little apple cider vinegar in it and some
Right.
all sorts of stuff. So it might be a good one for you. Dr. Dim, is there anything, any last, I never want to keep you guys too long because you're so free with your time and helpful to so many people that we're trying to reach out and kind of change the world together. But is there any, like, if you could give pet parents your best advice, what would you say? Because I'm going to let you go because we're coming up on the hour.
Okay. Always ask questions. That's the question. And always do your own research. The definition of a good doctor is a teacher. And that's what the word doctor means in Latin, is teacher. And so you want to gather the information, make an informed decision, always question whether it's something I say or another vet says or what they read, and come to their conclusions on their own. Don't think that anybody outside has the ultimate answer. It always comes from within ourselves for our animals.
See, that's what makes you one of the, maybe just my opinion, I don't know, hopefully it's not just mine, but I really do think that you're one of the best veterinarians in the country because you're not arrogant. Like, to be a teacher, you have to be willing to let people ask you questions, not just say I'm right and kind of go about your day.
Right.
So I love that you said that because I want people to know, when you're in there with your veterinarian, if he's not willing to teach you and educate you and be willing to listen to your questions, he's probably not a good doctor.
Right. Exactly.
But thank you so much.
All right.
So
you're very welcome.
Thank you so much. I hope to see you on the show, whenever you want to come on, and we'll talk on Wednesdays. So you're amazing. Thank you. Thank you, everybody, for being here. I hope that you've learned something from Dr. Dim. I know I always do every time I talk to you. So thank you so much.
Great. All right. It's great being here, everybody. Good night.
Have a good night, Dr. Dim.
Bye-bye.